The recent water crisis in Flint, Michigan has put the health effects of lead exposure into the headlines. While Alaska doesn't have the widespread issues with elevated lead levels like some lower 48 communities, lead exposure is still a serious public health concern in our state. In Alaska, about 2% of children tested have elevated blood lead levels. Even low levels of lead exposure can lower IQ, decrease a child's ability to pay attention, and affect academic achievement. No amount of lead is completely safe, especially for young children because of their rapidly developing brains and bodies. Also, the effects of lead exposure can linger. Lead can be absorbed and stored for many years in the bones. As people age or during pregnancy, stored lead can be released into the body, blood, and brain. Know the sources of lead in Alaska and minimize or eliminate exposure. In Alaska, the common potential sources of lead include aviation gasolines, old paint, lead ammunition and fishing weights, and some imported products. If working with lead, use appropriate personal protective gear. Wet mop rather than vacuum areas where there may be lead dust, such as indoor firing ranges, to reduce the risk of inhaling lead dust. And wash your hands well after handling lead. A simple blood test can detect lead in a person's body. Blood lead tests are recommended for children at age 12 and 24 months. Talk with your healthcare provider about whether you or your child should be tested for lead.